Hi everybody, today we will focus on the main point about poultry disease, one of the most important highly contagious disease affecting layers and bladder is infectious laryngotracheitis. We will focus on this opposite. Let's get started. Infectious laryngotracheitis is a highly contagious respiratory disease affecting chicken, affecting layers and bladders. The cause of agent is a double-stranded DNA virus, is a family of Gilead herpes virus, GHV1. The problem of this virus is the infected birds become carrier all over the time and all over. Infectious laryngotracheitis is an acute, highly viral respiratory disease affecting of chicken, which is the causative agent is a Gilead herpes virus 1, which is a double-strand DNA virus. The problem of this virus is carriers are produced by a previous exposure to a failed virus or a vaccine. Latency of the virus occur in two places or in two regions. Number one, trigeminal ganglia. Number two, trachea. Shedding the virus from 7 to 20 days after exposure. Many scientists say that this virus may be shedding the virus before signs occur. Pay attention. Transmission of the disease occurs when the infected bird contact with infected saliva, nasal discharge, or maybe a person carries the virus and infected the birds. We must pay attention to biosecurity in the farm. What are the kind of clinical signs I find in the poultry farm, layers, or a breeder? By the way, this virus occurred in Florida. In many farms I saw it. Clinical signs I see, number one, if it occurs mild form, maybe find dyspnea, expectoration, sneezing, coughing. If it occurs severe signs, we find severe dyspnea and expectoration of the blood from trachea, and maybe find a blood in the wall of the farm. What are the findings of postmortem lesion? Postmortem lesions we find in congestion of the trachea, maybe find a blood in the trachea. Diagnosis of this virus by PCR. What about the treatment? This virus is not treatment. Let's say first of all and foremost about the control. Control, we must isolation of infected birds, maybe vaccination before the virus enters the farm by tissue culture vaccine. Last thing we must talk about is treatment. This is a virus and no specific treatment of virus. We must use immune stimulant, use the vitamin A with a double or the triple dose to regeneration of the mucosa of trachea, and we use the mucolytic like volatile fatty acid, light oils, or oils that decrease or increasing the mucus from trachea and decrease the congestion in this trachea. We must use biosecurity. That's all. Thanks for watching.